habit of correcting, but I'm chief medical officer at Metroplex. Well, hello, Central Texas. Appreciate the opportunity to speak. As you mentioned, I'm here to talk about medical assets in the community. Let me just say up front that Bell and Coryell County are well positioned and more than capable of providing the medical needs for the civilian and military community. All our physicians, clinics, hospitals are within the TRICARE network, and we welcome TRICARE patients. I don't know if you see that up there, but we roughly have about 1,000 primary and specialty providers within the community. Their ratios, primary to specialty care, are here. Basically, gives us a ratio of about 1 in 400, one provider for 400 population. Moving on to the hospitals, we have about 1,166 beds spread across Manassas, Metroplex, Seton, Scott and White, the main hospital at Temple, and the Scott and White Children's Hospital, as well as Coryell. Now, I'm not counting Darnell or the VA hospital in those numbers, but just looking at those numbers, we have about 3 beds for every 1,000 population out there. So that puts us within the state and national norms of having enough providers to take care of people within the community. Now, ratios don't necessarily say everything. I can tell you from first-hand knowledge that Seton, for example, in Metroplex, we're not at full capacity. We run under about 80% capacity. My colleagues, my physician colleagues that have TRICARE patients, they tell me all the time they can use more patients. Bottom line is, we can support Fort Hood and the community as needed. Bring attention to this right here, this Dartmouth Institute of the Health Policy and Clinical Practice. Ranks Central Texas as #1 as being able to provide care at lower dollars. With that, I'm going to tell you about Scott and White. Because Scott and White was kind of placed at the top of the national arena and national highlights, because not only is Scott and White committed to quality care, but they're able to do that at this best dollar value. And Obama took note of that and basically used Scott and White as a hospital that other hospitals within the nation didn't want. Now, our medical capacity has grown over the years to meet the needs of our community. For example, if we look at our partnership between Scott and White and Metroplex, it allowed Metroplex to bring in specialty physicians that they were not otherwise able to get. And they're housed at the Hemingway building and also within our hospital walls of Metroplex. I want to remind everybody that Metroplex sits right outside of the Fort Hood Clear Creek exit. And you can walk to it from that gate. Now, between the area hospitals, areas I pointed out up here, Manassas, Rollinsbrook, Metroplex, Seton, the Scott and Whites, and Coryell, we have over 46 different specialties out there. The problem is I can't talk about all those different specialties because I'm not allowed to have much time. So what I would like to do is talk about some of the unique capabilities that I thought of that might be helpful for everybody to understand. Next slide. I'm not going to talk about all of them, but I will talk about, not necessarily in order. I want to remind everybody that there are 2 NICUs within the area. Now, Metroplex has a 4-bed, level 4 transitional care nursery that takes care of all babies that were born to mothers that were born early after 32 weeks. Now, on the other hand, Scott and White has about 48 beds in their NICU, and they're able to take care of all comers. They're considered a level 1 NICU. And while I'm talking about Scott and White McLean, I want to remind everybody that hospital opened up not too long ago. They've seen over 836 patients in their hospital since it's opened, and 936 neonatal patients within the NICU. Our diagnostic facilities, Metroplex, Scott and White, and Seton, all have developed diagnostic and interventional capabilities to be able to open up your heart vessels when you have chest pain within 90 minutes of the time you declare you have chest pain. That saves lives. All of us within the area have some type of behavioral care capability. has 60 beds, and they're able to take care of adult, pediatric, as well as adolescent patients. Cedar Crest, which is in Belton, which I don't have highlighted there, they have 30 beds, and they take care of adults, pediatrics, as well as adolescents. Scott White has about 24 beds, and as far as I know, they're only taking care of adults in inpatient arena. Scott White, if you think you have to go get transplants up in Dallas or Houston or Mayo Clinic, that's not true. 1997, Scott White did his first kidney transplant. After that, in 2009, they started doing heart transplants. 2012, they started doing a lung transplant, and that's not all they do. They also do pancreatic transplants, corneal transplants, as well as blood stem transplants. So you don't have to drive all the way to some of these cities 4 hours away and leave your family behind while you have this done. In the 1990s, Scott White partnered with Metroplex and actually placed Cancer Center right there on Metroplex Cancer. They have radiation therapy and chemotherapy right there. So the Killeen residents, the Harker Heights residents, Nolanville, Lake Passes, and Corpus Cove don't have to drive as far away as Temple to get their chemotherapy. Well, better yet, you don't have to drive to Houston, to MD Anderson, or San Antonio, or Dallas. It's all right. And then the other thing I want to talk about is wound care. Hyperbaric oxygen therapy is the newest thing. And we have 3 chambers within the region. We have one at Glen Passes at the Ronaldsburg Hospital, one at Metroplex, and one in Scott and White. They are helping people maintain their limbs. Those who have poor circulation, who are at risk of losing their limbs, this type of hyperbaric oxygen chamber works. It also helps heal pressure sores that have been resilient to other modalities of therapy. Bottom line, again, we have everything we need right here in the community. We can surge as necessary, we can flex down as necessary. And all these facilities are within 30 miles of the Clear Creek exit